Hello everyone, and welcome to this audio podcast today. This audio podcast as part of the Serology and Squil. This audio podcast as part of the Hustle and Serotype. This audio podcast as part of a Defcon premiere, and this audio podcast as part of a Storm Robotics production. So continuing on, and as part of this Defcon premiere. And having looked at IST or immunosuppression pharmacotherapies and AAR, now looking at sort of in and around bridging healthcare disparities, bridging healthcare disparities and inequalities through a theme in around patient in a theme in around what is referred to in literature as patient and public involvement, or PPI. So whilst a literature and investigations surrounding works in context of chemokines and receptors and transplant immunobiology have advanced, multidisciplinary team or MDT efforts and co-developing in context of and in for example health literacy to bridge healthcare disparities and inequalities have only become a recent intrigue. So for example, healthcare literacy and bridging disparities for those who suffer with long-term conditions or long-term illnesses have only been published since in around the new millennia. Modern clinical practices are delivered or offered by MDTs rather than at individual level, and this often requires a momentum of healthcare professionals from various specialties. And it is to be understood that incongruities in healthcare services and intercollaborative teams can lead directly to compromised patient care and inefficiencies. So relating to and regarding to PPI, which was a theme that was conceptualized by the National Institute of Healthcare Research, or NIHR, and the in around the NIHR and their sort of evidenced sort of framework referred to as Involve, or NIHR Involve, in around which again had been conceptualized in around 2014. In 2014 was conceptualized in around 2014 because healthcare services and research were or had a sense of disconnect to patient care in context of involvement between clinical and or non-clinical healthcare services. And so at the same time, the Royal College of General Practitioners, the RCGP, followed up with the patient with a sort of followed up with another framework referred to as the patient roadmap, that also looked to incorporate aspects of PPI, and especially in regarding to joining up best practices between patients best practices between patients and healthcare professionals. So that draws this audio podcast to a close. This audio podcast is part of the Serology and Squil. This audio podcast is part of the Hustle and Serotype. This audio podcast as part of a Defcon premiere. and this audio podcast as part of a Storm Robotics production.